Ourselves here today. I want to talk to you about breast cancer. October is Breast Cancer Awareness Month, and so I just want to give some basic information about that. A lot of people don't realize that breast cancer is the most common cancer in women, but if it's detected early, the five-year survival rate is actually pretty high. It's more than 90%. So early detection is key. There are some folks who do have breast cancer. They realize, like, what could I have done to prevent this from happening? There's so many factors that can contribute to breast cancer. There's genetics involved, and then there's environmental factors involved. When it's genetics, you got to be cautious. If there's a first-degree relative, that's like your mom, your daughter, your sister. Those are first-degree relatives. That puts you at higher risk. If it's in the family, you should probably be tested for the breast cancer genes. There's the BRCA1 and BRCA2. Those are the more common ones that a lot of people will be tested. So talk to your healthcare provider whether you should be tested or not. Now, there's the environmental factors are something you should be aware of as well. So, other than the genetics, activity level, they found that women, actually more postmenopausal women, are at higher risk for getting breast cancer if they're inactive. So, exercise is always key, and they found that if you do just like 30 minutes of walking daily, that actually can help to lower your chances, lower your risk of getting breast cancer. Now, again, the studies found that it was more of the postmenopausal women, but I think just across the board, everyone needs to do exercise. So if you can do 30 minutes of walking every day, that's a good minimum to do right then and there. The other one that could be risk factors, obesity. They found that if you're more obese, it puts you at more risk for exposure to hormones, estrogen in particular. So when you have a lot of fat, that activates this particular enzyme, that aromatase, that makes testosterone convert into estrogen. So more fat, more estrogen in the body. So a lot of the breast cancers out there are estrogen sensitive. So again, you gotta make sure you're not overweight, obese, and that kind of thing. And if you are, go back to exercise, healthy diet as well. The last thing is about hormones. So there's a lot of women now who are on bioidentical hormones or synthetic hormones. The last couple things about the two types of hormones: the synthetic comes from horse's urine, the bioidentical comes from plant source. You want to go more for the plant source. There's been a lot of large studies out there that have shown that bioidentical hormones actually have a protective effect. There's still risk involved if you have breast cancer. So I have patients who are on bioidentical hormones with a history of breast cancer in the family. I'm more cautious and I'll check their hormone levels closely, but safer results compared to the synthetics out there. But regardless, no one should ever have to be on hormones for the rest of your life, but you got to weigh the pros and the cons. How are you feeling? Are you having low libido, hot flashes, low mood, problems losing weight, all those types of things? So again, talk to your provider about that. But I guess the final thing is you got to talk about screening with your healthcare provider too. How often should you screen? So women should do monthly self-breast exams once in their 20s, but everyone 20s and 30s, you should be doing your yearly breast exam with your healthcare provider. Once you hit 40, that's when you should start doing mammograms. If it's in the family history, you got to do that sooner. So screening, again, as far as like detection, early detection, that's key, and then trying to minimize the environmental factors that will decrease your risk for breast cancer. So I hope this helps, and I'll talk to you later. Bye.